Zoloft, which is the trade name for Sertraline, is a selective serotonin reuptake inhibitor type of medication that is used in the treatment of depression, anxiety disorders, and panic attacks. Zoloft works by blocking the reuptake of serotonin, leading to increased serotonin levels in the neuron synapse. And the higher serotonin works to treat the depression, the anxiety, and the panic attacks. Now, Zoloft is generally well tolerated by most patients, but sometimes it may lead to side effects that will be explained in this video. And it is very important to remember that every patient will have a different experience with the side effects of this medication. So let's start by mentioning some random side effects of Zoloft. So Zoloft may lead to diarrhea, nausea and abdominal pain, dry mouth. It also may lead to lightheadedness, excessive yawning, and it may lead to insomnia. Zoloft may also lead to dizziness, excessive sweating, confusion, tremor, fatigue, and weight gain. Zoloft may also lead to emotional blunting, and emotional blunting is reduced intensity of positive and negative emotions, meaning the feeling of emotions is less than normal. Emotional blunting is also described as apathy, and apathy is like a feeling and lack of interest, and emotional blunting is also described as decreased motivation. And emotional blunting is dose dependent, meaning with higher doses of Zoloft, there is more emotional blunting. Now with Zoloft, just like with the other selective serotonin reuptake inhibitors, there is the sexual side effects. And those include anorgasmia, and that is failure to orgasm, and decreased libido, which is decreased desire, and genital numbness, and sexual anhedonia, which is decreased pleasure, and those effects are in both genders. And we have the erectile dysfunction that is specific to males. Now, the mechanism by which Zoloft causes the sexual side effects is not very well understood, and the sexual side effects are managed with the use of medications such as sildenafil, which is also known as Viagra. Now moving on to the other side effects of Zoloft. So Zoloft lead to increased suicide risk, and the suicide risk is higher with Zoloft, especially during the first few months of the use of this medication, especially in people younger than 25 years old. Now let's talk about the Zoloft withdrawal syndrome. So withdrawal syndrome occur when there is abrupt interruptions. So abrupt interruptions means that when the person misses 1 or 2 doses or more, or it occurs when there is sudden withdrawal of the medication. And sudden withdrawal means sudden stopping of the medication. And symptoms of the withdrawal syndrome include dizziness, insomnia, anxiety, agitation, and irritability. And the withdrawal syndrome might occur even when missing a single dose of this medication. To avoid withdrawal syndrome while stopping this medication, you have to slowly decrease the dose until you stop this medication. Now, Zoloft may also lead to higher risk of bipolar switch, and these side effects occur in patients with bipolar disorder. And the bipolar switch is the switch from depression into hypomania or mania, especially when used as monotherapy. So if we use Zoloft as monotherapy for patients with bipolar disorder, we have higher risk of switching from depression into hypomania or mania. But the risk of switching is back to normal if Zoloft is taken with mood stabilizers. Zoloft may also lead to increased bleeding risk, and that is because it may inhibit platelet aggregation. Zoloft may also lead to QT interval prolongation in the heart, and this effect is dose dependent, and it is not as significant as with the other selective serotonin reuptake inhibitors such as the citalopram. Zoloft may also lead to serotonin syndrome, and serotonin syndrome occurs when there is increase in the level of serotonin, and it occurs especially in case of combination of Zoloft with other drugs that elevate serotonin, such as the tricyclic antidepressants, the triptans, the tramadol, the lithium, the ST John's wort, and the tryptophan. And symptoms of serotonin syndrome include altered mental status, autonomic changes such as tachycardia, and neuromuscular changes such as tremor, rigidity, and myoclonus. Finally, Zoloft may induce the syndrome of inappropriate antidiuretic hormone secretion, and this occurs especially in patients aged 65 and older, and this syndrome leads to increase in the ADH, and this is a hormone that works on the kidney to absorb more water into the body, and this will lead to hyponatremia, and the hyponatremia will lead to symptoms like muscle pain, headache, and disorientation. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like and subscribe.